I'm not ready. Okay, g'day everybody, and thanks for tuning in, and I hope you're watching some of my blogs, and feel free to subscribe so you get notifications when I do a new one. Basically, I've been making a film on urine therapy and all things urine therapy. Actually, it's quite a fascinating subject, and I find that I don't have a lot of negativity. However, having said that, I have a lot of people coming up to me telling me their health problems and whether urine therapy will help. Now, a friend of mine, I'm going to use this term, sounds dodgy, but it's not, came to me and confessed that she has had a lot of problems with anal fissures. Now, this is apparently a common problem with a lot of people, and in women especially after giving birth, because it puts a lot of pressure in the lower inside bowel. Now, I had to Google a little bit about what they were, but they're like a little cut inside the wall of the anus, basically. Now, her problem's been going on for quite many years. You know, when you're wiping, at the end of a wipe, there's a lot of blood because sometimes, you know, you're adding aggravated pressure in the bowel movement, and depending on your diet also can scrape and irritate the anal fissure, causing it to bleed. Now, after a quite in-depth conversation about the process, you know, she's been in and out of the doctors for quite some time, and she says there's nothing, you know, dramatically that's improving, and they give you this cream, this rectal cream. And whilst having a great laugh about it, she goes, it's the most difficult thing. You've got to stick a little bit on your finger, and you've got to stick your finger up your bum, and you've got to, you know, wipe it on the inside of the wall, and it's all sticky, and it sticks to the finger, and it's just a nightmare, and it gives you a headache if you use too much. And the principle of this cream is to draw blood into that area to hopefully heal that process. Now, unlike a cut on your finger, we've got air and we've got sunlight and we've got all these other things that can heal quite quickly. But when you've got something that's in a dark area that gets no sunlight and no air, it's quite a hard thing to improve. So she's tried the creams for many times, and she says basically it's a pain in the butt. Pardon the pun. Back to the doctors, and the doctors said the next stage is using Botox. Now, I was quite taken back by this, but having a bit of a joke and saying, well, at least your ass is going to look pretty and quite young. It is a painful process of having a needle stuck up there, and that's just to relax apparently the inside wall and give it a chance. Now, if that fails, then they operate, which is no, you know, walk in the park, because, you know, imagine going to the toilet after having an operation and doing things like that. It's also a painful process. So I had talked to her about urine therapy and how it works in many forms, not only by drinking, but also anal douching. This is common, and people use it who have bowel cancer and low bowel cancer, and also women who use it in their vaginas for other illnesses, yeast infections and STDs and so forth. So it can actually reduce those things. So I told her basically the principle of is get a kit from the chemist or wherever you buy one of the kits from, fill it with your urine, place it into your backside, just ever slowly putting it into there, leave it as long as possible until it's uncomfortable, and then release. Now, most people who drink urine find the side effects of urine, and one of the downsides or reactions is diarrhea. Now, for someone who's got anal fissures, this is probably a good thing, because it's going to loosen all the stools and make it easier as a bowel movement rather than a heavy stool which could irritate the walls. So I said, give it a go, give it a few months. You know, it's going to take time, and get back to me. Something I would love to film, but I don't think it would really make to the cut of the documentary. Well, the visual of it anyway. So, in a desperate state, and obviously Botox was, you know, pretty traumatic, and it's pretty much been going on for years and she hadn't resolved, she gave it a go. And you wouldn't believe what happened. Within just 1 week of doing 2 douches a day, she said the blood stopped when she went to the bathroom. She was so excited by this, she actually stopped the method and thought it was cured, but it came back a week later. So then she continued the method again for 1 whole month. was really good. And I said, well, get a checkup and see what the doctors say. So on that checkup, after a month period of doing the douching, the anal fissure was healing and almost closed. Now, how does it work? Well, urine also, being sterile, is going to clean that area as well. It's antibacterial, it's antifungal, and it's a byproduct of our blood. So therefore, it's putting blood into that area as well. So it's keeping it fresh, clean, and giving it a chance to heal. So for all those people that have got this uncomfortable subject, and it is a subject most people wouldn't like to talk about, and there's this great show in England called, Embarrassing Body Parts, and they do dive into some of these embarrassing areas. Anal fissures is a thing people wouldn't want to talk about. It's uncomfortable. It's in an area we tend to, we don't want to talk about. So as much as that is, I thought I'd share that story, and for all those who have that problem, maybe give it a go and try it out, leave it in there, and the method is the key, I guess, and obviously clean up your diet, because, she was eating more healthier too, so helps the stools be a little bit looser. But the method was, about a cup of urine inside, squirting it in, and just leaving it in there for, 20 minutes, and then releasing. Her stools were really quite loose, not rinsing out afterwards, just leaving it and remaining at that. And then ever so slowly it will work and heal on you. So best of luck for all those. Sorry about the interesting subject, but it's one of the miraculous healing methods of urine therapy. See ya.